Let me ask you something. Have you ever skipped buying healthy food because it was too expensive? Avoided going to the doctor because you couldn't afford the appointment? Stayed in a stressful job because you need the income? Lost sleep worrying about bills? If you answer yes to any of these, you're not alone. And here's what the wellness industry doesn't want to talk about. Financial stress is one of the biggest barriers to stress to health that exists. Most wellness advice completely ignores it. You're told buy organic food, join gyms, hire personal trainers, get regular massages, take supplements, see therapists. All great advice if you can afford it. But what if you can't? What if you're choosing between paying rent and buying groceries? What if the stress of your financial situation is literally making you sick? I'm Jay Roy, founder of Nike One, and this is the Health Hustle Podcast. Today, we're talking about something that desperately needs to be discussed. The connection between financial stress and physical health. Why money worries affect your body in ways you don't really realize. And how to protect your health even when money's tight. This isn't about just telling you to make more money. This is about real solutions for real people dealing with real financial pressure. Let's start with honesty. Financial stress is one of the most common damaging forms of chronic stress, and it affects your health in profound ways that go far beyond what you might realize. In the UK alone, over 60% of adults report that money is a significant source of stress. In the US, the number one cause of stress for people is this. This isn't just feeling worried, it's chronic, relentless stress that affects every aspect of your life and health. People with high financial stress are more likely to have heart disease, high blood pressure. They're at higher risk for mental health issues, including depression and anxiety. They're more prone to obesity and diabetes. They're more likely to delay or skip medical care. At increased risk for substance abuse. And they're more likely to experience relationship problems they're less likely to sleep well. Financial stress doesn't just make you feel bad, it makes you sick. When you're stressed out about money, your body responds the same way it would to any other threat. Your stress response activates. Cortisol floods your system. This hormone increases appetite, especially for high calorie comfort foods, promotes fat storage, particularly around the midsection, breaks down muscle tissue, raises blood sugar levels, suppresses your immune system, interferes with sleep, impairs memory and decision making. Chronic financial stress keeps cortisol elevated constantly. This isn't designed for long-term activation. It's short-term survival mechanism. But when it stays on indefinitely, it damages your health. Your cardiovascular system takes a hit. Blood pressure stays elevated. Heart rate increases. Inflammation rises. Risk of heart attack and stroke increases. Your digestive system struggles. Stress affects gut mobility and digestion. You're more prone to IBS, acid reflux, ulcers. Your gut microbiome is disrupted. Nutrient absorption decreases. Your mental health deteriorates. And anxiety becomes constant background noise. Depression risk increases dramatically. Cognitive function declines, and so it makes it hard to function, to remember, make decisions, and then sleep quality plummets. Here's where it gets truly difficult. Financial stress creates a vicious cycle that's hard to break. Financial stress goes to poor health, goes to medical expenses and missed work, which then goes to more financial stress, which then worsens your health. Financial stress can also go to poor sleep, then goes to reduced productivity and decision making, which has career impacts, which then creates more financial stress. Or financial stress makes cheap, unhealthy food choices, then makes health problems, which then gives you more medical costs, which then gives you more financial stress. Each cycle reinforces others, creating a downward spiral that feels impossible to escape. Here's something the wellness industry won't tell you. Being poor is expensive for your health. When you can't afford preventive care, like small problems become big, and then expensive problems, healthy food so that you eat what's cheap and available with damaging your health, like safe housing, so exposure to mold, toxins, violence increases with health risks, like time off work, so you work while sick, making recovery slower. Stress management resources, so like therapy and gym, etc., etc. Sleep quality. You have where you work multiple jobs, you live in like unsafe neighborhoods, you have poor housing. You do pay with your health, and you pay again with medical bills when that poor health catches up with you. Most wellness advice is written by and for people with financial security. It assumes you have discretionary income for gym memberships, supplements, organic food, time for meal prep, workouts, self-care, access to healthcare, therapy, specialists, safe neighborhoods to walk in, the mental bandwidth to optimize your routine. But if you're stressed about making rent, choosing between medications and groceries, working multiple jobs just to survive, that advice isn't helpful. It's just insulting. Just eat organic. With what money? Get a personal trainer. Are you serious? Reduce your stress. My stress is that I can't pay my bills. The wellness industry has a huge blind spot around economic reality, and it needs to be called out. I run my wellness business. Well, I work with clients, and I'm very aware of the tension. When I started Nikon, I had to think about how to make wellness accessible without pretending that financial barriers don't exist, because they do. They're real, they're significant, and ignoring them doesn't help anyone. This is why we offer different service levels and why we focus on what's actually essential versus what's just nice to have. Why we acknowledge that sometimes the biggest wellness intervention someone needs is help with their financial situation, not another meal plan. Let's get specific about how financial stress impacts actual health decisions you make every day. This is the most obvious, but worth examining in detail. When money is tight, you often have to choose the cheapest calories available. And the cheapest calories are usually high in sugar, salt, unhealthy fats, low in nutrients, designed to be addictive. A bag of chips costs less than a bag of apples. Fast food is cheaper than cooking healthy meals, especially when you factor in time. Ramen is cheaper than fresh vegetables. But here's the thing. These cheap foods don't actually satisfy you nutritionally. So you eat more. They spike your blood sugar and crash it, creating more cravings. They promote inflammation and disease. They leave you absolutely terrible. You're not really saving money. You're just paying in different ways. Poor health, medical bills, lost productivity, shortened lifespan. But when you're broke right now, thinking about health consequences years from now isn't realistic. You're just trying not to be hungry today. Financial stress makes people avoid healthcare even when they need it. People skip preventive checkups so they can't afford a copay or time off work. Necessary medications, so rationing pills, not fulfilling your prescription. Mental health care seen as as optional when money is tight. Dental care often not covered by insurance and is also very expensive. Follow-up appointments, which hoping the problem resolves itself on its own. This is why poor people have worse health outcomes. It's not that they don't care about their health, it's that the immediate financial burden of healthcare feels more pressing than future consequences of avoiding it. And then small problems become big, expensive emergencies. The thing that could have been handled with the £200 office visit becomes a 20 grand hospital stay. Just go to the gym assumes you can afford gym membership fees. Time to go to the gym. Childcare when you're at the gym, safe transportation to and from the gym, workout clothes and shoes, the energy left after working long hours. For someone who works 2 jobs to make ends meet, coming home exhausted, living in an unsafe neighborhood, responsible for childcare, gym membership isn't the solution. And while exercise can be free, walking like bodyweight exercises requires time, energy, and safe spaces, all of which financial stress often limits. Financial stress destroys sleep in multiple ways. Directly, with anxiety about money keeps you awake. Working multiple jobs or long hours limits sleep time. Shift work disrupts natural sleep rhythms. Indirectly, you can't afford comfortable mattress or bedding. Noisy, unsafe housing disrupts sleep. Can't afford to keep the heating or cooling at comfortable levels. Sharing sleeping spaces, multiple people in one room, and make poor sleep makes everything worse. Your health, your decision making, your ability to work, your stress levels, all of it. Most stress management advice costs money. Therapy sessions, yoga classes, massages, meditation apps. Sometimes they're free. Spa days, vacations. When you're financially stressed, spending money on stress management feels absurd. You're stressed because you don't have money. Spending money to manage that stress just creates more stress. So you don't manage your stress, and it builds and builds, and eventually it breaks you. Financial stress affects relationships and social connection. Can't afford to go out with friends. Embarrassed about your financial situation, so you isolate. Relationship conflicts about money. You can't participate in social activities that cost money. You move away from support systems for cheaper housing or better jobs. And we know from previous episodes that social isolation is terrible for health. Financial stress often creates that isolation. This is huge and often overlooked. When you're poor, you're just time poor. Working multiple jobs, long commutes, cheaper housing, further from work, no flexibility in the schedule, dealing with the bureaucracy for benefits and managing financial crisis. All the free health advice, meal prep, exercise, meditation, sleep hygiene requires time. Time you don't have. It's not that you don't want to be healthy, it's that you're making impossible choices with limited resources. Constant mental burden of financial stress is exhausting. Calculating a week purchase, juggling bills and paying dates, anxiety about unexpected expenses, shame about your situation, fear of the future, cognitive load of managing scarcity. This mental load depletes your willpower, decision-making capacity, and energy. There's nothing left for optimizing your health routine. I mean, you got studies that show that financial scarcity actually reduces cognitive function. Your IQ effectively drops when you're stressed about money because so much mental capacity is consumed by managing that stress. Let's look at what science tells us about money-health connection. The adverse childhood experience study shows that childhood poverty is one of ACEs that predicts poor health outcomes in adulthood. Growing up poor affects stress response development, brain development, like health behaviors learned, access to healthcare, nutrition, likelihood of chronic diseases. This isn't about personal failure. It's about how economic stress literally shapes your biology from a young age. In the UK, life expectancy differs by over 9 years between most and least deprived areas. In the US, the gap is between richest and poorest can be about 10, 15 years. This isn't about healthcare access. It's about chronic stress, environmental factors, working conditions, nutrition, safety, all tied into economic status. Being poor shaves years off your life. That's not hyperbole, that's data. There's a connection or conception in medicine called allostatic load, the cumulative wear and tear of your body from chronic stress. People with high financial stress have elevated allostatic load. Higher inflammation markers, elevated cortisol, poor cardiovascular health markers, weakened immune function, accelerated cellular aging. Your body is literally aging faster from the stress. People with financial stresses are 3 times more likely to have depression, 4 times more likely to have anxiety disorders, more likely to experience suicidal ideation, so having those thoughts in your head about more prone to substance abuse. This isn't weakness. This is a normal human response, sustained, overwhelmed stress. Financial stress is one of the leading causes of relationship conflict and divorce. And we know that relationship quality directly affects health. People in unhappy relationships live longer, and social support buffers stress. Relationship conflict increases health risk. So financial stress damages relationships, which causes health, which damages health, which creates more stress. Parents' financial stress affects children's health. Stress during pregnancy affects fetal development. Stressed parents have less capacity for optimal parenting. Financial instability creates childhood stress. Poor nutrition affects the child's development. The health impact of financial stress doesn't just affect you, they affect the next generation. Okay, We've established the problem. Now let's talk solutions. Real practical solutions that don't require spending money that you don't have. You can improve your nutrition even on a tight budget. Frozen vegetables, just as nutritious as fresh, cheaper, no waste. Dried beans, lentils, their protein, fiber, are incredibly cheap. Eggs, also cheap, complete protein. Oats, cheap breakfast, filling and nutritious. Seasonal produce, cheese, which is cheaper when in season. Store brands, so same nutrition, just lower cost. Bulk buying, my favorite, when possible. Lower per unit cost. Batch cooking saves time and money. Simple meals like rice, beans, eggs, vegetables, oatmeal minimize food waste. So use everything. Plan meals around what you have. Learn basic cooking skills. So cooking from scratch is cheaper than convenience. Foods, which may encourage you to buy like cookbooks, which are great, by the way. One of my friends, Alexina, she has a great book set out that you could probably try and buy. Food banks and pantries, and no shame in using them. Community gardens offer some free produce. Government-assisted programs, if eligible. Discount grocery apps. So Too Good to Go, Fast Food. There's all kind of apps out there. So the truth is, you don't need organic, grass-fed, free-range everything to be healthy. Regular produce, frozen vegetables, dried beans, and basic proteins are absolutely fine. The wellness industry has created unnecessary anxiety about food. You don't need a gym membership to move your body. Push-ups, squats, lunges, planks. YouTube has thousands of these free workouts and it requires zero equipment. It's free. Walking, completely free. Can be done almost anywhere. Extremely effective for your health. Some gyms offer free trial periods or community days. Community centers often have low-cost classes. Parks have free outdoor gyms now in many areas. Running groups are often free to join. Use stairs in your building. Dance to music in your house. Do exercise during TV commercial breaks. Active play with kids counts as exercise. The key is consistency, not fancy equipment or expensive classes. Improve your sleep without buying anything. Make your room as dark as possible. Foil on windows if necessary. Keep it cool. Open your windows. Use fans if you got them. Reduce noise with your earplugs because they're cheap. White noise from your phone and apps, that's free. Consistent sleep routine, even on the weekends, not screens for 30 minutes before bed. Simple relaxation routines, so breathing exercises, stretching. If you can't sleep, don't stress about it. The stress makes it worse. Use worry time earlier in the day to address anxieties. So practice acceptance of what you can't control. Free stress management that actually works. So we have the 4-7-8 breathing, which is free, works anytime, anywhere, and is scientifically proven. Box breathing, simple breathing. Walking, especially in nature if accessible. Stretching, dancing, talking to friends or family. Online community support communities, religious or community organizations. For mindfulness, you have free meditation apps. Many have free versions. Simple, present moment awareness. Gratitude practices, this costs nothing. Creative outlets, you can do writing, journaling, drawing or doodling, singing, lots of ings, but this is active stuff that you can do. Any creative expression will do the job. For time and energy management, when you're time poor, efficiency actually matters. So you can do batch tasks. So cook multiple meals at once. Do all the errands in one trip. Batch similar activities together and prioritize ruthlessly. So what truly matters for health is sleep, basic nutrition, some movement. Everything else is optimization, not necessity. So use dead time. Exercise while watching TV. Listen to educational content during your commute. I love audiobooks. Love them. Educate my little brain while I'm driving. Meal prep while catching up with family on the phone. Then say no. Say no to things that don't serve your health or well-being. Say no to obligations that drain you. Say no to guilt about what you should be doing. Protect sleep above everything else. Sleep is free and has the highest ROI for your health. Prioritize it over almost everything else. Mental health support options are getting help when money is tight, feeling free or sliding scale therapy. So community mental health centers, universities, psychology clinics, like student supervised, which is much cheaper, online therapy platforms with financial assistance, support groups. These are often free. You got crisis resources, so the suicide prevention hotlines, crisis text lines, community crisis centers. You've got like self-help resources. So library books on mental health, free online sources, podcasts like this one, peer support communities, healthcare navigation, making healthcare more accessible, prevention, use preventive services. Many screening are covered by insurance. Address small issues before they become emergencies. Know what's covered by your insurance. Don't be afraid to ask. They would love to hear from you. So cost reduction, we can ask about generic medications, use prescription discount programs, ask hospitals about financial assistance programs, negotiate medical bills. You can do this, all right? Trust me, you can. Community health centers, sliding scale fees based on income. So same quality care, but a much lower cost. Preventive focus, cheaper to prevent than to treat. So basic health maintenance, so sleep, movement, stress management, that prevents expensive problems later on down the line. Look, here's the truth. All health hacks in the world won't fully solve the problem if your financial stress is overwhelming. Sometimes the most important health intervention is addressing the financial situation itself. Improving your financial situation is a health intervention. It reduces chronic stress, improves your sleep, increases access to healthy food and healthcare, reduces relationship conflict, improves mental health. This isn't separate from wellness. This is wellness. I'm not a financial advisor, but here are some approaches that could help reduce financial stress. Get clear on the reality. Know exactly what you owe to whom and when. Know exactly what you earn and what you spend. Learn tracking. We can teach you. Certainty increases stress. Clarity reduces it. Make sure to prioritize ruthlessly. So housing, food, utilities first. Everything else is negotiable. It's okay to let some things go. Ask for some help. Talk to creditors about payment plans. Ask family or friends only if it's safe to do so, because not all family and friends are great. Seek financial counseling. Many nonprofits offer free services. Use available assistance programs. Some small improvements can matter. So reducing debt by even £50 a month reduces stress. Building even a small emergency fund helps. Any improvement to financial security helps your health. So the income side, I would say, can you increase income? Now that's easier said than done, I know. Are there benefits you're eligible to but you're not using? Can you negotiate better pay at your current job? The expense side, where can you actually cut without sacrificing health? What's truly necessary versus habitual? Can you reduce housing costs? Often the most biggest expense. The mindset shift. Some mindset shifts can help. From shame to reality. Financial stress is not moral failing. It's a systematic issue affecting millions. You're not alone and you're not weak. From perfection to not good enough. You don't need optimal health, just reasonable health. Good enough is good enough. Small improvements do matter. From the health to agency. You can't control everything, but you can control something. Focus on what you can influence. Small actions do add up. From comparison to your own path. Stop comparing to people with different resources. Your health journey looks different, and that is okay. Do what works for your situation. When to seek professional help? Some situations need professional support. If you're experiencing self-deleting thoughts, severe depression or anxiety, substance abuse, inability to function, relationship violence, seek help immediately. There are free crisis resources available. Look, here's the bigger picture. Individual solutions help, but we also need to acknowledge this is a systematic problem. Healthcare, housing, food, education shouldn't bankrupt people. Poverty shouldn't be a health sentence. We need policy changes, not just personal optimization. I can give you tips for eating healthy on a budget, But I also need to say, it shouldn't be this hard. The system's broken, and that's okay. But it is broken. At Nikon, we try to approach wellness with economic reality in mind. We offer different levels of service because we know we can't serve everyone and not everyone can afford comprehensive programs. Full 360 wellness for those who can fully invest, lighter packages for essential elements only, individual sessions or pay-as-you-go program. The goal is accessibility, not exclusivity. Focus on what's essential. We help people identify what's truly necessary for their health. What's optimization versus foundation? Where the limited resources will have the most impact. Not everyone needs everything. We help people prioritize. We don't pretend financial stress doesn't exist or doesn't matter. We talk about it openly and we work around it. If a client says, I can't afford that, we don't push. We find alternatives. This is the whole picture. Part of 360-degree wellness is acknowledging that financial health affects all other health. We can't separate stress management from financial stress. We can't talk about nutrition without talking about food access. We can't optimize sleep while ignoring housing instability. We address the whole reality, not just the easy parts. We try to create community where we can, share resources and strategies, support each other, learn from each other, feel less alone. Sometimes the most valuable thing we can provide isn't training or nutrition. It's community and understanding. Here's your action plan for protecting your health when money is tight. This week, assess your situation. What's your biggest financial health stressor right now? Food, healthcare, sleep, time? Pick one. Pick one free intervention. Choose one thing from this episode that you can do this week that costs nothing. Find one resource. Identify one free, low-cost resource in your area. So food bank, community health center, free exercise option. And this month, build one healthy habit. Pick one sustainable, free, healthy habit to build. So walking, home exercise, better sleep routine, and address one source of stress. So take one action to reduce financial stress. So payment plan, cutting one expense, applying for assistance. Connect with one resource. So actually use one free or low-cost health resource that you identified. In the long term, protect your sleep. Make sleep your non-negotiable health priority. It's free and it's a huge ROI, return on investment, just in case you didn't know. Build movement into your life. So find ways to move that fit your schedule and budget. Focus on stress management, daily practice of free stress management. So breathing, walking, connection, that sort of thing. The free health essentials. These cost nothing and the massive health impact. Consistent sleep schedule, walking, breathing exercises, connection with others, drinking water, spending time outside if it's safe, basic bodyweight exercise. So some resources to explore: food, local food banks. You might find some in Sainsbury's or Tesco's or something. You might find food bank. Local community gardens, food grocery apps. They're all out there. Healthcare, community health centers, free clinics, sliding scale services, hospital finance assisted programs, or in most cases, the NHS. Mental health. They are crisis helplines, which are free and they're 24/7. There's community health centers. There's online peer support groups, low cost therapy options. Exercise. There's YouTube fitness channels. There's us. There's free apps like Nike or Nike Free Training Club. I think they've got one as well. Community centers, walk-in groups, or running groups. But remember, you don't need to do everything. Pick one thing. Do it consistently. Build from there. Here's what I want you to take away from this episode. Financial stress is a health issue. It's not just in your head or something you need to power through. It's affecting your body, your mind, your relationship, and your lifespan. You're not feeling if you can't stand or you can't afford expensive wellness programs. You're dealing with real economic constraints in a system that's stacked against you, but you're not helpless. There are things you can do to protect your health even when money is tight. They might not be glossy, Instagram-worthy wellness practices, but they work. Sleep is free. Walking is free. Breathing exercises are free. Connection is free. These fundamentals have more impact than any expensive supplement or program. If you can address your financial situation even slightly through budgeting, assistance programs, increasing income, reducing expenses, that is a health intervention. It's not separate from wellness. It's core to wellness. At Nike One, we try to make wellness accessible because we know that health shouldn't be a luxury only available to the wealthy. Everyone deserves to feel well, regardless of their bank account. If you're struggling with financial stress and want support with building sustainable wellness practices that work with your reality, visit nikeone.co and take our compatibility quiz. We'll find the approach that fits your life and your budget. Share this episode with someone who's stressed about money and health. Let them know that they're not alone and it's not their fault. And remember, your health matters regardless of your financial situation. You matter. You're worth taking care of, even when resources are limited. Do what you can with what you have, where you are. That's enough. Until next time, this is J-Roy reminding you that wellness isn't about perfection or expensive interventions. It's about taking care of yourself with whatever resources you have. You've got this.